I'm Dr. Rob Winn, and you're listening to Real Cancer Talk from VCU Massey Comprehensive Cancer Center.
Hello, and welcome to today's podcast. I am Marcie Wright, the Deputy Director for the Alliance for Equity in Cancer Care, also known as just the Alliance. We're thrilled to bring you this special episode created in collaboration with the Journal of Oncology Navigation and Survivorship and the Alliance. This episode is part of our 10-piece series celebrating the latest achievements and advancements in navigation within cancer care. So, what exactly is the Alliance? We're a multi site initiative working to advance health equity by improving access to high quality, culturally responsive care for patients from underserved communities. With a $20 million commitment from the Merck Foundation, our program partners with community organizations to better reach populations disproportionately impacted by cancer. Joining our conversation today will be Dr. Robert Winn and Ms. Sharon Gentry. Dr. Winn is the director of the VCU Massey Comprehensive Cancer Center, a National Cancer Institute designated facility that provides advanced care, groundbreaking research, education, and community engagement. He leads efforts to establish a 21st century model of equity in cancer science and care, involving community partnerships to address disparities locally and globally. We welcome you, Dr. Winn. Ms. Sharon Gentry has over 40 years in oncology nursing with 25 years in patient navigation. She founded North Carolina's first oncology navigation program in Winston-Salem, connecting care systems and community resources. She holds a nursing bachelor's from UNC Chapel Hill and a master's from UNC Greensboro. A member of the Academy of Oncology Nurse and Patient Navigation since 2009, Sharon served as a program director and is now editor-in-chief of JONS and Conquer. Currently, she participates in local navigation and nurses chapters and lectures nationally on oncology navigation. Welcome, Ms. Sharon Gentry.
Thank you very much for inviting me here to hear about this Alliance for Equity in Cancer Care. I have watched it develop over the years, and when you see the numbers and the differences these programs are making, it literally takes your breath away. This is how navigation should be done. It is replicable and it is sustainable in each different community. So thank you for allowing me to shout out the great work that you're doing.
Ms. Sharon, I know you wouldn't say it, so I'm going to say it for you. You know, you have been a champion for navigation when most people thought it was just this cute little thing. You, right from the beginning, recognized how important it was, forming organizations, writing about it, aligning people, getting conferences together. So, ma'am, I just want to let you know, because I know you wouldn't say it. Anytime I get to share a panel with you, I know I'm in good stead because all your work has been centered on only one thing. That is getting and making sure that everybody has access in the best possible. We know the importance of navigation. I'll end with sort of saying that that's part of the fun of the Alliance, is that, we had all of us coming together, supported certainly by our industry family with Merck, but all of us came together and thinking about the different strategies of navigation, of not only can we put in place the best practices, but how can we learn from one another? And I think that having this group together as an actual alliance and having some amazing people like you and others, at the helm, we've been able to do, I think, some good things and learn some good things about how navigation isn't a one size fit all, but that it really is as precise. The precision that's needed in this is as much as the precision needed in next gen sequencing, where we're actually trying to find the next drug for the next person. This is just about people and community. So again, Dr. Wright, again, you're not going to give yourself a shout out, so I'm going to do it for you. Thank you for being really the steady hand and from an operational perspective and everywhere else of making sure that this alliance stays an alliance and actually is productive.
Thank you, Dr. Winn. Thank you, Sharon. So let's get started. Sharon, what are you seeing nationally in this space? And how has the work of the Alliance contributed to our goals of ensuring the best outcomes for all patients through navigation?
I am seeing many different techniques, procedures, pathways for oncology patient navigation right now. But it goes back to the community. What does the community need to make sure that patient navigation is meeting the needs, whether it's accessibility, education, pulling the community leaders together, saying we can do this better? So when I look at the Alliance for Equity in Cancer Care, again, it comes back that what you're doing is detailed in such a way that it can be replicated in other communities. We are all too busy. We are all too short-staffed to reinvent the wheel. So I feel like the Alliance is putting that wheel out there for us. You're showing the processes you use. You're naming the people that come together at the table. And you're doing that in a way that you can say at the end of the process that the Alliance is doing, this is sustainable because we've made a difference in X. Your metrics are astounding, and I want to share that with the whole world. So that's why I'm so excited that we're doing this series in the Journal of Oncology Navigation Survivorship. So each of your program can step up and be highlighted, and hopefully the readership can identify with something in that program.
Dr. Winn, there are a lot of initiatives around patient navigation, but the Alliance is unique in its collaborative approach within the community. Why do you think the Alliance's community-rooted approach is so critical for its success?
You know, I was thinking about this, and we just had a recent experience where we were able to witness with my own eyes the importance of this alliance and the courage, innovation, and just true, what I'm going to say, just grit of getting it done. Imagine, and you, Marcie, Dr. Wright, were right there when we heard the testimony of a married couple that had been married for 60, almost 60 years.
Yeah.
In not just rural Montana, but frontier country. This program not only sort of wanted to do what we have been doing, but it challenged the sort of ideas about what we could do to make it possible. Hearing from a woman that said she got the diagnosis of cancer and was certainly ready to give up, and her husband sitting right next to her said he was, not ready to give her up, but he knew that he had no other choice. And so they were making plans because the drive from Bozeman to Dillon was difficult and during the winter almost impossible. And so like many Montanans and like many other people in rural communities and frontier communities, they have to make the choice of saying, we're going to just choose to make our peace with our maker. 2 years later, they're there holding each other's hand because this program was able to figure out how to take navigation, not only getting a person to something, but occasionally bringing things to them. You see, navigation, I think, and part of the alliance, and I've learned this from not only Sharon and others, is just about exactly what you said, getting what we need to get to the right communities and the right people at the right time so that they can have access to being healthy and a chance of being healthy. I think what I loved about this is that we've done everything from frontier country to rural to urban underserved, high densely populated areas like in New Jersey. And what there is one commonality, and what you're getting at, Dr. Wright, is that bottom line is for this to work, you have to have a plan. You do have to have resources. It certainly has to be organized. It's not just by goodwill, but when you put those together with actually focused people, things get done. So that's what I've been the proudest about. It's clear that while the geography may be different, the challenges of our patients are always pretty much the same. And that is having access to the best possible care that they can get and having a chance at hope. So that's what I've learned.
So we know that the cancer journey isn't just medical. It includes the social drivers of health that impact care access and outcomes. I want to take a moment just to quickly highlight some of our partners. Dr. Winn's kind of already talked about our Conquer Cancer and the ASCO Foundation and the amazing work that they're doing in Dillon, Montana. We've spared more than $100,000 in just travel costs. An additional $15,000 have been provided to these patients in associated social services and costs. the Kentucky Markey Cancer Center, they've launched this amazing patient app. So it's right there in these patients' hands. From Hazard to Lexington, patients can receive their navigation services in the ease of their hand through an app on their cell phone. We're also partners with NCCN, who's adopted its health equity report card so that it can now be used in a community oncology setting. This is huge for adapting these changes right there within the community. Um, Another partner is Robert Wood Johnson, Barnabas Health. They've transformed its navigation program on its head. They're intervening early in the cancer care journey, starting at the emergency department and even before diagnosis. Mary Bird Cancer Center in Baton Rouge, Louisiana, has expanded its patient navigation program by over 174% in response to its demonstrated success. Boston Medical Center created an institutionally funded navigator role after demonstrating the value of navigation. Case Western, they've increased the enrollment in their partners program by more than 20% since January. And MSK, or Memorial Sloan Kettering Cancer Center, has expanded its Integrated Cancer Care Access Network, also known as ICANN, to improve access and within patient navigation. So through our partners, we're really starting to see some of the difference, some of the impact that the Alliance has made across the entire United States. As I just described, all of these programs are dealing with navigation in its own special way. And within the Alliance, we've decided that we're not focusing on the person, but we're focusing on the process. So, Dr. Winn, how do you think that the Alliance is using this as a way to be able to really transform the landscape of navigation?
Yeah, no, absolutely. And I want to pick up on something that Sharon said. This isn't, people think of outreach, engagement, and navigation as just acts. There's a science to it. There's a history to it, dating all the way back to the 90s, and with luminaries like Friedman and everybody else. We know that. But what we've learned from each other is that I think, and Sharon, I think you said it best, it's resources, it's operations, it's actually understanding the science that goes with it. It's understanding the details and the data. It's getting a little bit more sophisticated and using tools, right? Because that's all AI is, and figuring out how we can deliver the best intervention and how we can get it to people the best possible way. What I've learned is that had you asked me before the great experiment was done with the Alliance, I would have said, it's probably easy to get it in highly densely populated urban areas, but we probably won't be. When it comes to rural, yeah, and when it comes to frontier, no way. We've disproven all of that. It turns out that, like that old commercial used to say with the Marines back in the day, a few good folk. With a few good folk that are very thoughtful with detailed plans and the right resources and information and data, we can come up with processes that are not just without soul, but that are full of soul. And so when you bring the humanity together with the stringency of and detail that's actually needed to pull off and operate these programs by evaluating our processes, what you have is an outcome that I think is undeniable. In fact, to be honest with you, I'm going to tell you before Michelle jumps on this that I'm going to say that the 36% fewer Americans dying from cancer in large part isn't just because we came up with new molecules that became medicine. It's because we were able to get people to those medicines. And that actually stems from not the actual medicine itself, but from navigation, which is a core component that runs throughout it all. So I don't know, Sharon, if you agree.
Oh, I agree wholeheartedly. I absolutely agree wholeheartedly. You hit on every key concept that was there. And it's all about the community. We know that there are enough cancer patients to go around. So this is not a competition. This is how we can make sure when those people come through the door, no matter where they are, frontier, rural, city, wherever they are, they're going to get the same standard of care as they come through that door. And that's exactly what navigation process does. It evens the playing field. And by you sharing what you're doing, there is no excuse for people out there, no matter where they live, to say, I can't do this. Yes, you can. Look at these numbers. Look at this process. It is driven by a team in every one of the grants that you have. It is a team focus, and it's not someone working in their silo. They're working together. I've always thought navigation pulled things together. It was that seamless thread that goes through the healthcare system that makes it look like the patient that we're a seamless thread. And we know we're not. We all have to work to improve our processes and get along with the department beside us. But we always keep this that center focus on that patient. Let's get that patient through. And then you're pulling that family with them because that family has got opinions. They've heard myths. We've got to get them through here too. And when you leave with a better educated patient and a better educated family, those strong networks in the community hear about it. And those people become spokespersons for you. So I'm excited to see this whole process come together in the way that you've done each of these grants.
We know that early access leads to better outcomes, and the cancer journey isn't just medical. The Alliance is heavily focused on addressing social drivers of health. How can others incorporate these factors into their patient centered care models as well?
Let's talk about these social determinants of health. They're very different where I live, they're very different where you live. So here's the key point. Do you know what they are? And I always think this goes back to the studies that have been done over time in oncology care. The patient sees things one way, and the healthcare providers see them another way. So we've got to use that patient voice. When we are starting navigation programs, each navigator and the whole process of navigation is told to walk in those patients' shoes, see it through their eyes, hear it through what they're hearing, and that way you can pick up what are the main social determinants of health that are impeding their care. We may think it's transportation, but sometimes you may be fooled, especially when we have a lot of those little church ladies that say, yes, I can take that person to treatment. Or, you just have to listen to what they do. So, yes, social determinants of health are very evident in each one of the processes that you do here. And you do have to restructure around what they are. It's not always going to be, we always did it this way. Nope, take that off the table. Let's come together. How can we do it better and more efficiently?
No, I'm so glad you said that because I was thinking to myself as you were saying that, and as always, spot on, that one of the things that I think most people are surprised by is that they will say, well, I get rural, why navigation is difficult there, and why the travel time is 3.5 hours. Not recognizing that in some urban areas, trying to get from, say, for example, the South, places in Chicago to one of the main academic hospitals, maybe only 8 miles, but could take you up to 2 to 3 hours to get to and to get back. What I learned from this program is that it's sometimes, I've learned this scientific term. I had to go back to high school actually to recall it, this context of distance versus displacement. And sometimes we talk about the distance traveled, but the reality is if the distance traveled is like a circle, you can still wind up in the same spot. You didn't move, right? So you moved, you covered distance, but there wasn't any displacement. As I'm starting to think about the language and the framework of how we are getting to our patients, I think that using this alliance as an example, we were able to discuss, there are challenges in both urban, frontier, and rural settings. So the distance is one thing, but how do you tackle the distance in one area? It might be by if we had volunteer planes, which I wish we had more retired, people who are actually were flying and could do these little things, all the way from that to how do you not just give someone a subway pass? How do you functionally get someone to get from point A to B? I think that the conversations are starting to get a little bit deeper, but I think what you said was, how do you look at the individual patient and get them what they need?
Agree 100%. You're teaching them how to fish. You're not giving them fish.
We're not giving them fish. I learned that from you the very first time we were together.
Oh,
We always hear Dr. Wynn say the Alliance's approach is community informed. It's not a one size fit all. And the overarching goal is to create better access to cancer care. And you guys kind of touched on this a little bit already, but can we discuss a little bit more about how creating these earlier access and these earlier opportunities will be leading to better outcomes, specifically timely diagnosis and treatment, and the role that navigation can play in improving that area of cancer care?
So, Dr. Wright, you just hit on it, right? We know that even though we have more miracle medicines than ever, but with cancer, timing matters. If we can get you your care early, it turns out that you have a better survival rate. What navigation does is it tries to narrow the disparity field, but what good, solid navigation can do is it can not only identify that you have a need, but it can get you through. Actually, once you get into a health system, you still need to be navigated. This is what I keep telling people. Just because you got to the front door doesn't mean that you know how to get through the 16 and 32 different rooms that you have to make. This is where navigation cuts down that time, makes it much more efficient, and I think does save lives. By the way, good navigation also just doesn't, once you get your treatment, just leave you, leave you and just say, hey, bye-bye, your treatment's over. Good navigation continues to understand that wellness matters and that survivorship actually. And by the way, when you say, how do you do this early? Great navigation, which I think Sharon and others have actually also advocated, isn't always in a health system. It's around prevention. It's around behavioral changes that can have interventions right in your community. So good navigation just isn't an activity. It really is a whole framework for me that I've actually come to pick up, that it's nursing navigation, community activators, I mean, the whole nine, but working together as a team that says that if once you're notified of getting cancer, how do we get you to the door, right? That's one part of navigation, but how do we get you through the door is another really sophisticated level of navigation. All of those pieces, when done right, will allow you to get to your diagnosis quicker, your therapy faster, and actually, once you're done with your therapy, to get to what I actually really do believe is another goal of navigation, it keeps you whole and well by, again, continuing to figure out what is it that you need to be healthy.
I agree 100%. And what we know that navigators do, the navigation process, when performed well by trained navigators, is that trust in the healthcare system. How many of us live around cultures or live around communities where they don't trust the hospital, they don't trust what's going on, but yet you've got someone in the community that says, let me listen to you and what do you need to understand? And we often use people within their own community to talk to them and to work with them and say, this is what we can do. So it's a chain of trust as you pass this patient along from the community to the treatment to survivorship. And that's where navigation makes a huge difference. It's just not one person, it's a team of person. And I could not agree more that the community is a central part of everything we do.
So I'm going to switch gears a little bit and talk about the alliance and the work of navigation in a national model. How do you think we can continue to scale this at a national level and get more people to see the importance of navigation?
Now, you know I'm going to want to hear from Ms. Sharon on this one.
Okay, I've got this one because I will tell you that by attending your alliance meetings, I was like, oh my goodness, this is a pearl. This is a hidden pearl, and we need to get it out there. So that's why I'm so appreciative that each one of your programs is going to step up and publish in the Journal of Oncology, Navigation, and Survivorship. It's great that you're getting it out there in your own alliance world, but we need to take it beyond your walls. We need to get it out there where people can read about it. And you're so easy to access when people may have a question. They may call you, Marcie. They may call the Perkins Cancer Center. They may call whoever, but your group is willing to talk with other people as they go forward and say, yes, this is how we did it. If I heard of your process and I wanted to put it in place in my rural area, it may not work, but if I can go head to head with somebody on your team and say, tell me what worked and tell me what barriers that you ran into and what did you do to overcome those barriers, it prevents me from having to jump through that hoop and learn on my own. I'm going to learn from you. And so by your willingness to share, you're telling the world that this can be done in any community and by many different processes.
Absolutely. Absolutely. Couldn't agree more. I
Dr.
was about to ask you, Marcie, what do you think? I mean, you're the one seeing us all, what do you think?
Being the deputy director for the Alliance has truthfully opened my eyes to the role that navigation can play across all the landscapes. Like you alluded to, we spent some time recently in Montana, in Dillon, Montana, and it was really exciting to be able to see how something as what one would think as simple as just offering an infusion suite, two
Mm.
infusion suites in this small town could lead to such enormous change. And so when you see that, it just invigorates you to say, you know what, we can do this across, we can take this model into different rural towns. My parents grew up in a small town in South Carolina, outside of the big city, that didn't always have access to some of these resources. And so some of my passion for this work is driven from that to say, hey, this is an opportunity to be able to expand some of the things that we're doing in these rural towns into some towns that look like where my parents grew up. So I'm really, excited about these opportunities. When we think about leveraging some of these local and community resources, of course, I immediately think about the University in Kentucky and how they partnered with some of their local communities to be able to go right in that app and link their patients to resources that are right in their community. They can go through that app and be linked up with a service that they need to address some of their social drivers. I think about the work that Mary Bird Perkins is doing and their navigation program and how they're linking up their navigators with their patients and kind of holding their hand from the start to the finish of their cancer journey. And when you think about the work that's being done and how folks are leveraging not just their community, but their local resources and their regional resources to expand this work, it's really, really exciting. Dr. Winn, would you like to comment about some things that we can expect to come down the line as far as support for navigation is concerned?
Yeah, I have to say that, things, can be a little bit unstable. Um, but there are some truths. And I think people recognize that while the push for AI is certainly something that is laudable and should happen, while the emphasis on development of new drugs has actually certainly had an impact. I mean, there's no doubt about it that molecular targeted therapy has changed the game, that immunotherapy has changed the game, that better chemotherapy and, more tissue sparing surgeries have all changed the game, as well as imaging. But what really has changed the game is the unheralded hero or heroine of this story, which is navigation. What I remember that in all administrations, including this one, there is a recognition that navigation matters. And that when you try to uncouple the reduction of 36% fewer Americans dying from cancer, even if you tried, it'd be almost impossible to disentangle it from the fingerprints and the actions of good, solid navigation. And so when I think about the national, sort of look, I think what has become more interesting is over the last 20 years, it's become much more accepted as a fact as opposed to something that's still evolving into waiting to see if it has value. If you would have told me about 20, 30 years ago, there were people who were out there who knew this way before anybody else did, who actually almost within the first year were like, duh, navigation matters. It took a little bit of time for the rest of the community to actually understand that because we were so enamored with drugs and so enamored with new screening techniques and so enamored with new imaging modalities that we forgot that navigation is central to the success of almost all of that. independent of who you are. And so what I would say on the national stage is that some people were fearing that we might actually see navigation get less funded. I'm going to say that what I've seen is that I think that with folks like Sharon and others raising our voices in unison, and with programs like the Alliance, it becomes the evidence, the data that sort of says this is not just some sort of feel-good activities, this is the impact. So I actually think the future for navigation and all of its various forms of navigation still sit on pretty solid ground. Now, that may be overly optimistic, but I have to say that most of the things I'm reading, and which are tea leaves mostly, by the way, but as I'm reading those tea leaves from both the federal and the state, I don't think that there has been this major push to rip and cut and gut navigation. So I think as I look in the future, I'm cautiously optimistic that people have gone from, us proving the value to them knowing the value of good, solid navigation.
Sharon, where do you feel like the alliance aligns with the future of navigation?
I think the Alliance is leading the future of navigation, if you want me to be honest. I have a favorite saying, and I share this with all the navigators. You only know what you know. And Marcie, from your conversation you just had and from Dr. Winn's comments, think of all the education that has been done at each one of your sites. Navigators learn, the healthcare professionals learned, the community learned. It was all about educating each other on what can be done to best meet that patient needs. And so I think that education is a strong foundation of navigation. And you're willing to share that with many people as you go forward and say, this is what we've done. With every number that you give, whether it's financial, whether it's save visits for travel or save miles for travel or getting AI into someone's home or even having a patient access care, there is value to every number. So return on investment is screaming from the work that you're saying. And it's teaching nurses, it's teaching all types of navigators, the patient navigator, the social worker, that you do make a difference, and return on investment is part of your job. You can make a difference, just not in financial numbers, but other numbers.
I think that one additional area is the voice that we're putting towards the collaborative care model. We're really through the alliance pushing this whole concept that it takes more than just the patient. It takes more than just the family. It takes more than just the provider. It takes us all. It takes the community, and it is truly a collaborative care model that starts from the beginning and ends at the end with everyone being fully engaged, informed, and active in the decision making process. Let's transition a little bit now to discussing some of the challenges. When we're talking about the alliance and we're talking about navigation, we really focus on all of the great things, right? You're saving money, you're saving miles, you're saving travel, you have reached more people, we've reduced time, we've improved timeliness of care. But that all comes with some challenges. Some things that we know from our grantees is that staffing and retention is definitely a challenge when it comes to navigation and even this collaborative care model. Additional challenges around institutional buy-in. Navigation isn't free, right? And so how do you get your institution to buy into some of these efforts?
The biggest challenge is change. You're asking either the community, the healthcare system to change, but you're not doing it alone. So you're including the voices or you're inviting different ones to the table. And when I look at the change of, I think what's going to be critical in the future, you've hit it on a couple times here, is your emergency room care. What drives people to the emergency room for care? And my thoughts are that we might be, the way some of the healthcare policies are going to drive more people to emergency room care. And the reason I say that is I can remember I am going to consider myself an old navigator. As an old navigator, before it was a popular term here, I sat down with the emergency room nurses and said, if you have a patient that comes through the door and needs this, call me. Call our department. So again, it becomes that I had to open my door to help them when they come. And that way I took some of the load off of them by people that come through the emergency room that truly needed navigation at that point for me to connect them into the system and to get the care they need. So again, here comes education. That's part of that thing. We've got to educate people on what we're doing and what we can do for the patient and help them and say, I can take this part of load off of you. And it's going to make a difference, I think, in the future.
Wow, always. I mean, that was spot on. The thing that I don't, for me is a challenge and remains a frustration is the sense that sometimes health systems still believe, erroneously, by the way, that navigation is a nice thing to have, but not necessary for their bottom line even. And trying to get people to understand that if you have effective, efficient navigation, not only are you able to increase the volume of patients that you can sort of see in your system, and not only do you save money, and not only do you save lives, but it's just good practical sense. And yet, there are still some health systems out there that actually focus on the new MRI, which is they should, the new surgical suite, which obviously they should, the new clinics, which are definitely, and the workforce that goes with that clinic. But I'm going to say to you that actually, I think that a mistake that many health systems make is not putting into that mix at the very beginning effective strategies, practices, protocols, and procedures around navigation. So I think if I look at one of the challenges in the future, it's going to be obvious resources, but that's an obvious one. That's like what was the little show, I think it was a movie, but Broadway show, Cabaret, where money makes the world go round. Well, to be honest with you, resources are important. So I'm not going to underplay the importance of having resources, but I am going to say resources and with a very wise, practical, pragmatic, forward-thinking health system that integrates navigation into its fabric as much as the next medicine. I think that if we can get over those two humps, I think we would do a lot.
I agree 100%. If you build it, are they going to come? Or do you need someone to make sure they can access and get to the MRIs, the new surgical suites, the new clinics, which, yes, they are needed. You build them, but you better have a process of how you're going to direct people there.
The funny part is that I always wanted to modify that you build it, they will come to our health system people and says, you build it, but the reason why people would come to those baseball games is because people would tell them you should come to the new stadium. It just doesn't organically happen.
Absolutely.
And so I think many people think you build a building. Most of the people run past the building and go, what is that for? So people still have to be told and people have to be made to feel comfortable and excited. And you cannot convince me that that's just not advertising. That is evangelizing with navigators.
It is trust and word of mouth. And that's what navigation is all about.
And I think there's data to back us up that all the commercials in the world doesn't drive. So it's funny to me that we're talking about this, and yet some of the best and brightest have not understood from our health systems that this is an integral part, not a nice part, an integral part of how do you make a successful health system mostly, and then how do we do right by our patients.
So you both talked about, if we build it, they will come. How do we keep them there? How do we build a sustainable model around that?
I quickly will just say, because I really am interested in what Sharon's thoughts on this, but I would quickly say that one of the important pieces on this that we can't forget is that the emerging theme of public-private partnerships. It's important. I was reminding a group last week that when we think of public-private partnerships, we think as if those are just new. Remember that the aqueducts of Rome were actually the best example of public and private partnerships, right? The government sort of said to certain builders of aqueducts, if you partner with us, we'll make sure you share in the proceeds that come after, so you can have sustainability for your business. In fact, I think that as we start thinking about this, certainly health systems, certainly industries, certainly foundations, and certainly the government, all working together as a team will actually be the magic formula, because I think one of those alone might be good, but thinking about a sustainable model, I think a sustainable model comes with partnerships, particularly in healthcare and particularly with navigation. So if I had my magic world, it would be an ideal that we continue to push forward the ideal of what good, solid, trustworthy, and trusting public-private partnerships look like to sustain navigation efforts.
Oh, you hit it on the head, because I was going all the way back to civilization. And it is what is out there, what is being said about the care that patients receive, where they go. It's that word of mouth that makes a difference. And that was even before we had the written word, or even we had all these cell phones and all the social media. It was truly the word of mouth that can make or break a community. And so when we're going forward and we're building these private and public, I guess, acquaintances as they go around together, you've got to have that voice of that patient there. You've got to ask them, what do they need? Are we meeting your needs? And what do they want? So that's critical in anything that we do going forward at this point.
And as we close today, I just wanted to give you an opportunity to, you know, to close out with anything that you wanted to say regarding next steps with the Alliance, Dr. Winn, or where you think we should go next, Sharon.
I think the biggest thing I have is that we're transitioning from does navigation have value to clearly its value. Now we have to figure out how to make it, how to sustain that value. If I had to leave it with one word, because I know we're coming close on time, I would say I am cautiously optimistic and hopeful for the future of navigation, because I am confident that and a well knowledge about the impact it will have. So the impact is not the question. It's whether we will have sustainable mechanisms to make sure and ensure that everyone gets the best possible access to care.
And I'm going to say on that, we are now being recognized nationally by CMS, by the COC, that we do make a difference in the world of oncology care. We are seeing other chronic diseases come on and try navigation, whether it be cardiac, whether it be HIV or whatever. They're also using the navigation principles that we're using. So behind each one of those, again, is that keyword of metrics. And metrics wasn't always financial. And you've showed it in every one of your 8 programs, and you showed it differently each time. That it makes a difference, whatever you're measuring, but things have to be measured. We can't just say we do this process. What are you doing with this process to make a difference? Are you keeping people out of the emergency room? Are you making sure that people get the care that they need? So it's just all about metrics and what we can do to take that forward and keep putting those out there in a national way and make sure that navigation is represented on many of these government and private organizations.
Well, thank you, Sharon, and the Journal of Oncology Navigation and Survivorship for giving us this platform to be able to, get our word out and what the Alliance is doing and the work of the Alliance. We're looking forward to continuing to work with you as we roll out the additional 9 pieces that will come out from this series. Thank you guys for your time, and this was phenomenal.
No, thank you. And as always, thank you for your steady hand and constant reminding of the importance of the Alliance and outcomes. So thank you, Dr. Wright. And as always, I just always enjoy being in the presence of Sharon. Thank you.
Thank you. And I'm so excited for this Alliance for Equity. You are really steering people forward. You're leading navigation. So all I can say is keep it up.